Welcome to the ThinkData Podcast in partnership with Dataworks. Today, I welcome Brandon Atkinson to the show. Brandon is the CEO of CareRev. They're a really interesting health tech business, which is effectively, it's nurse founded and it's a tech enabled staffing platform that connects healthcare facilities directly with local clinical professionals. As I mentioned, super interesting solution. It enables flexible on-demand shift coverage without relying on traditional staffing agencies. Really unique product. And actually, in terms of your background, before we kind of get deeper on CareRev and really understand the use case and the problems it's solving, I was keen to really understand a bit more about you and kind of what brought you to CareRev in the first place.
Yeah, absolutely. Well, first of all, Alex, thanks for inviting me on the show today. Happy to be here and excited to talk to you.
Likewise.
I've actually celebrated my 2-year anniversary very recently.
Congrats.
And my whole career has been in scaling enterprise technology companies, generally B2B technology companies of one sort or another. It's my 8th startup. And, just love working with smart, passionate people to build great companies together. I got into healthcare specifically maybe about 5 years ago, initially in biotech with Vivek Ramaswamy, the presidential candidate over at Roivant Sciences. We just raised $1.2 billion from SoftBank and launched that company, and then went to Clearly Health, which was a med tech company. And we invented AI that helps you and your cardiologist understand your risk of heart disease, helped them raise $222 million, brought that product to market for the first time, and then decided to try my hand in healthcare staffing solutions at CareRev's. So having a great time, and basically came because I'm just incredibly passionate about our purpose as a company, which is to really empower nursing staff to live life on their own terms through our technology platform, while concurrently helping hospitals and health systems lower their labor costs while ensuring they always have the best possible patient care at the best possible time.
Yeah, I love obviously the mission statement is one thing, but obviously the solution is solving a genuine problem. For the people who are listening here, we've got majority of our listeners here in the US, but we also have people in the UK and further afield. How do hospital systems typically staff? So when you obviously have the typical nursing and model, you'd expect them to, well, either they're through an agency or they put an advert up and they will recruit people directly. But that's not the case, is it? So how do they typically staff from a nursing standpoint?
Yeah, what hospitals and health systems typically do is first they have 3 legs of their workforce. The first leg is their full-time staff. And so they hire as many nurses as they can. And generally there's a nursing shortage. And so they supplement that with an internal resource pool. And internal resource pool is effectively internal staff that work on an as needed basis, but they're employees of the hospital. They may float around to different facilities. They might float around to different units within a facility. They're inherently floaters by nature. That's kind of the nature of the job. And they're inherently used on an as-needed basis. And because of the nursing shortage, they frequently need a third leg of the stool, which are contingent staff. And so that's also where we help. And so with those 3 legs, typically they're managed in very siloed ways. So there's like your full-time staff are managed through your scheduling system, and they're permanent. And then there's like different staff that manage your internal resource pool, your internal flow pool, and that tends to be different technology. And then there's this third group of sort of premium or contingent labor, which is frequently managed through like spreadsheets and emails and last minute phone calls. And it's all like the life of a staffing person in a hospital is really actually quite extraordinarily difficult, complicated, and stressful. And so we actually do 2 things. Part of it is covering that third leg of the stool, which you mentioned before, through our external marketplace. But actually recently, we also now cover that second leg of the stool, the internal resource pool. And so we created, our clients asked us to create a version of our marketplace technology that they can use for their own supply and demand. And so what's really powerful about that is, you mentioned, how do they work now? Well, they typically have these 3 different silos. And now through a product that we call IRP Plus, it actually allows them to treat all 3 of those as one fungible group of talented staff that can work as needed. And so you have the lowest possible cost for the best possible patient care just through a rules engine. And so now, instead of just manual phone call spreadsheets and emails and all this chaos that is the staffing office, they just put in a rules engine and say, hey, first make these shifts available to my full-time, because maybe our union rules say like they need to get them first. And then if they don't pick it up, shift it, cascade it over to our internal resource pool. And if they don't pick it up, then cast it over to marketplace. So that's kind of the new, much more modern way of working, which we're excited to work with hospitals on.
Yeah, it's interesting. Obviously, we're going to dig a bit deeper on RP Plus as well shortly, because I think that's a really interesting solution. I know it's obviously been recently launched, but in terms of the benefit to the nurse, so obviously whether it's nurses specifically or within that kind of healthcare ether, what's the benefit to them of actually having this product in place?
Yeah, I mean, the nurses love it. I mentioned the purpose of the company is to empower nursing staff to live life on their own terms.
Mm.
And so the reason the company was founded was in recognition that being a full-time nurse is really, really hard. You've got these long 12-hour shifts. You're on your feet all day. You're dealing with emotional and physical trauma all day. Nowadays, you're dealing with workforce violence. You're frequently treated like a cost center because technically you are, which means you're very frequently underpaid, undervalued, underappreciated. Like, it's just really hard. But for nurses, it's not a job. It's a calling. Like, they tolerate all that stuff because of their deep passion for being at the bedside and giving patient care. And so for the nursing staff, we actually allow a much more sustainable way to do that, because they can work through the platform to work when they need, how much they need, where they want to. And so some of our nurses, they only work this way. It is their full-time job, just working, shifts as they need it in a full-time schedule. For other nurses, they actually have a full-time job somewhere else, and they're just working nights and weekends. For other nurses, they're taking care of their family or their kids or whatever's going on in their life, and they only want to work a few shifts a month. And so this enables them to do that as well. So for nurses, it's a pretty powerful way to follow their passion for caregiving in a way that's really aligned with what they need out of their life at that point in time.
Yeah, it's super smart, isn't it? Because obviously you've got that kind of, the contingent worker, the full-time worker who's bound by the shifts that they're given, but equally, life doesn't, go that way, does it? You've got a weekend, you've got a sick child, you've got actually elderly parents. You think, actually, I can't be committing, especially the nurses. And I can speak from the UK standpoint, the hours they work, the pay is typically quite low. The pressures they're under are very high. How does, I know artificial intelligence is obviously the rage now, and every company, SaaS company out there is trying to implement some form of AI into their solution. How does CareRev kind of adopt AI technologies, and what's the benefit from whether it's a pay rate standpoint, where it's from a cost-effective standpoint? Where does AI play?
Yeah, great question. There's two primary ways AI supports our platform and thus supports our hospitals and nurses. The first one is an inherent challenge all hospitals face is that what's called patient census, like how much demand for beds is there at any given moment, fluctuates rather unpredictably up and down across time, across facilities, across specialties. And so what's really needed is what's called predictive analytics, the ability to look at both what do we know about historical demand for our services as a hospital, and what do we know about how many staff are available when and where, to then provide predictive analytics to say, look, based off of what's been happening historically, we believe that you're going to need this many staff of this specialty on this floor at this point in time. And we know you're probably going to have a shortage given what we know about what's currently staffed. Thus, hospital, you should probably think about staffing these roles. And so you're predicting for them where the needs are going to be. You're then presenting for them like, hey, do you want to post these shifts either through the IRP or through Marketplace or both to fill them? And then they're just saying, yep, I agree, go. Now, once the shifts are out, for the ones that go into the Marketplace, the second way AI really helps is a tool that we call Smart Rates, which is based off of that history. We know how hard shifts will be and how hard shifts won't be to fill. And we also know, given as they get closer, what certain take trends are for when clinicians take those shifts. So we use AI to basically predict what's the rate we should offer for this specific specialty at this specific facility at this specific moment in time, meaning that the pay rate to the clinician is going to change over time based off of supply and demand dynamics to make sure that you can fill the most possible shifts at the best possible rate.
That's super smart. So what you're saying is effectively based on trends data, either you're looking backwards, but then also using AI and predictive analytics to, identify a future trend. It may be, as an example, it could be a Saturday night on an emergency ward is typically going to have, higher stress levels, and actually then you would effectively tweak the rate that person could earn based on that data.
That's right. The AI adjusts the pay rate that's being offered through the marketplace to clinicians who are going to pick up a shift. Because typically what hospitals do is it's a static rate, and at the last minute it's not filled, so then they boost the rate by like 20%. And then so nurses frequently know you're going to do that, and so then they wait till the last minute, and then you boost the rate, then they take the rate.
And then no one knows.
Yeah, you sort of like know the nursing behavior and you know the supply and demand dynamics so that you don't actually do it that way. It's not something a nurse can game because it's all AI driven.
Yeah, that's very interesting. So from a cost standpoint, and obviously in the US specifically, the cost of healthcare, is very high, and obviously the associated cost of staffing and infrastructure is obviously very high as well. How does your solution help hospitals and health systems kind of manage their costs there? Because on that point, if you're waiting to the last moment because everyone's waiting and you have to keep putting your rate up, I'm guessing that you're not always keeping a handle on your costs. But if you've got your tool, you can actually predict, because you've got a fixed rate based on your predictive analytics. This is actually what it's going to cost us based on all is that quite accurate?
Yeah, there's three major ways we help hospitals and health systems reduce their labor cost. And this is, frankly, probably the number one driver of why they work with us. Is how do we reduce our labor costs while providing as good, if not better, patient care? And so there's three ways. The first one is, ever since the pandemic, all hospitals and health systems are drastically trying to pull back on travel nurses specifically.
And what is a travel nurse for people who don't know?
Yeah, great question. So a travel nurse is basically on-demand, it's provided by a staffing agency, and the staffing agency says they offer hospitals. It's basically a 13-week assignment, in which the hospital is paying not only your salary but also a stipend for travel and housing and other related costs.
It's costable,
so really quite expensive, and you're locked into this 13-week contract. And they do it again because they know they're going to have a shortage. And so it's a blunt tool to make up for a shortage of nursing staff. And so what we say is, look, by and large, you can stop all travel nurse spend and instead replace it with these on-demand nurses. And the on-demand nurses, it's a much more cost-effective model because you're not locked in to 13 weeks. Because of that 13 weeks, maybe you actually only needed somebody for 10 of those weeks, or maybe you needed somebody a lot on Monday, Tuesday, and Wednesday, but not so much the other days. With per diem nursing, you only do it on demand. So it's sort of like AWS and like Amazon, cloud on demand sort of model where you ramp it up. When you need more, you say you dial up, I need more. When you need less, you dial it down. Well, an on-demand workforce does that for you. So you're getting off of travel onto on-demand. The second major way that helps you save cost is the other thing that hospitals do is they provide incentive bonuses and overtime for their full-time staff to take these shifts. And those end up being as expensive or sometimes more expensive than just using an on-demand staff. So it greatly reduces, those types of incentive bonuses for internal staff. And then again, just the third way is just by, through the AI to maximize the rate. So, you're never locked into a rate. You're always paying as little as possible to get the level of a fill that you need.
It's really interesting. You touched on the COVID point. It's unfortunate enough to my day job is I recruit, and a lot of the companies we recruit for are within the healthcare technology space here in the US. And one thing a lot of the founders and leaders like yourself will reference is post-COVID, they've seen an increase in the demand for their product because it's removing administrative burdens, it's freeing up staff, but that's to counteract the sheer volume of people who've got out of nursing and frontline care, and in terms because obviously COVID was so challenging. How are you therefore managing, whilst you can't necessarily be directly responsible for the nurse themselves, how are you ensuring that nurse burnout and, you know, the issues you look at with people who are becoming less engaged with this environment? How's CareRev kind of helping the nurse themselves as opposed to just looking after the hospital?
Yeah, it's interesting because a benefit that people don't frequently think about when they think about providers like us is the benefit to the engagement of the permanent staff in the hospital themselves. So these aren't staff that are coming to the marketplace. It's the burnout of the permanent staff. And keep in mind, it costs, depending on the system, anywhere from $40,000 to $60,000 in the US to replace a nurse who quits. So burnout is a very expensive problem. And so the number one driver of burnout are insufficient patient to nurse ratios.
Yeah.
Because again, it's a calling for a nurse. It's not a job. And so there's nothing worse for a nurse to say, I am here. I'm sacrificing myself with all of these hours, all of this stress because I want to give great patient care. And if you can't give great patient care because there's not enough nurses on staff and you're spread too thin, it just sucks all the joy out of it for you.
Yeah.
And so by ensuring you always have the right staffing level, you're ensuring that you're avoiding that problem is the first thing. But the second thing is when you don't have proper staffing, nurses, there's this thing called a nursing ladder, or working at the top of your license versus the bottom of your license. And it's effectively like, are you doing the work that you're most valuable and capable of doing, the highest level work for you? And if you have insufficient staffing levels, nurses are frequently not working at the top of their license. So they don't feel like I'm doing the best work I can do, the work that I'm most uniquely qualified to do. And so by leveraging an on-demand workforce, you're keeping your nurses working at the top of their license, which keep them most engaged and happy and delivering the best patient care. So like these issues are why 40% of all RNs, according to a study recently that came out by AMN, plan to leave the field by 2029.
Yeah.
And terrifying so to keep your full-time nurses, you have to provide these flexible offerings.
Yeah, so they're seeing the benefit, and they would obviously feel better and more empowered knowing that actually there is the support there. Because as you rightly touched on, if 40% are looking to get out, there's a reason for that. And so actually, in terms of you controlling that message externally, I'm keen to touch kind of the marketing here. And obviously, you've had huge successes. You've been here, as you said, coming up for 2 years, or just as of 2 years recently. Talk to me about that kind of getting the message out and how you're taking the CareRev product and saying, because everything you talk about is so compelling and so you just make sense. Think, this just makes complete sense. But talk about kind of that go-to-market piece, and actually the B2B, B2C side of this is actually there's two strings to the bow, isn't there?
Yeah, you're absolutely right. It is a B2B and a B2C business. It's a very complex business. And so fortunately on the B2C side, unlike traditional agencies, like we don't have recruiters. There's no phone calls. There's no one-to-one reach outs. It's a scaled model. And so we have technology that we call a talent engine that automatically reaches out to all the jobs boards, all the social sites, or all the places where we know nurses are.
Interesting.
To promote that, hey, we have jobs available through the marketplace. So we're able to get talent. We call it a hidden workforce that hospitals and health systems and agencies can't get on their own because they don't have the efficiencies of scale provided through the technology. And so it's the technology driven recruiting that then, like, the message of CareRev exists to empower you to live life on your own terms is very powerful for nurses. And so what we found is, like, the nursing shortage isn't the bigger problem. The bigger problem is a shortage of nurses that want to work like hospitals want them to work, which tends to be very inflexible. And so when you offer this type of way to work, we find that nurses just show up. And so the B2C marketing part, as long as it's technology driven, is pretty easy. Now, I'm sorry, the B2C. Now, the B2B is different. So we're selling into the acute care space, so large hospitals and health systems. And we're generally selling into CNOs, chief nursing officers, or chief HR officers. And the thing about them is they have to believe that you really get them, that you understand their pain, that you understand their workflows, that you understand their businesses, that you understand their history. And so it's actually really, really important that you have nurses talking to nurses. It's really important.
Yeah.
And so we have a lot of RNs, and we were founded by an RN in our company because they're unique problems, they're unique challenges, and you need to be able to speak their unique language, and you need to be able to truly understand their problems, which isn't just like, hey, I need people. It's much deeper than that.
It's a credibility factor, isn't it? It's being able to relate. You're selling a solution. You could hire a solution seller, but ultimately, if you've got someone who's actually maybe been in that space, understands the use cases, understands the problems, you're just going to get further ahead. When you look back to your last couple of years, and what's the number one, if maybe it's one or a couple of things, what things stand out as kind of really proud moments where you think, oh, do you know what, we achieved that, and that was really good to see?
Yeah, great question. The first one would be is when we launched our IRP Plus product, our internal resource pool technology that allows hospitals to manage their own internal staff. Our product team was on site, our engineering team was on site for launch day, like making sure that everything went smoothly, and we were training up the clients. And we've got this video the product manager did of the nursing, the staffing scheduler, and she. Because effectively how it works is they put the shifts in their scheduling system, then they automatically get broadcast out to our marketplace and gets broadcast out to their internal resource pool. So the nurses can just pick up shifts through the mobile app, right? And so normally, they're posting the shifts and then they're reaching out to nurses. It's like all this work. And there's this video of where she posted the shifts. And then 5 minutes later, she looked and they were all claimed. She's like,
oh, wow.
What happened? Like, I didn't do anything. Like, all of a sudden, these shifts are all claimed, and I had to do nothing. Normally, she's got this like binder that she's looking in and saying, well, who might be available, and what specialties can they cover, and what days are their preferences? And there's none of that anymore. It's like magic. Post the shifts get claimed, patients get great care.
Fantastic.
Yeah.
That's really interesting. So if I'm a nurse, they're registering, I'm guessing. So they have to put all the credentials, and obviously they need to make sure they've got the, as you touched on that point, they got the right experience, they've got the right accreditations. And then that affects you. Then it will pop up through a push notification, or something will come through, and then they will claim that shift based on the job details or the requirements of the shift.
Yeah. We ensure that nurses can only see shifts that they're qualified to work.
Oh, interesting. Okay.
Yeah, we do all of the credentialing and background checks and drug tests and all of that to make sure not only that everybody is high quality and credentialed and able to work, but actually like they can't even see shifts that don't match with the credentials that they have. So we're vetting the marketplace to make sure that that is highly protected, and that obviously is incredibly important. But then for nurses, they don't have to do any work. Anything that they're qualified for will automatically show them their shifts. They see it on the app. Our nurses generally are looking at their mobile app 4 to 5 times a day. Say, hey, what shifts are available? Which ones do I want to work? And it's, they also engage directly with the facility. If they might be floated from like one facility to another, like they don't need us in the middle. They can work directly with the facility through the app to make that all really easy. Yeah,
it's really interesting. It's a superb business. I know when I got the insight that I was going to have you on today, I was looking into care, and I just thought it's something, obviously as someone in staffing, I've been for 25 years. It's, with the classic more recruiter, but actually this makes sense. And I think from an AI disruption standpoint, there's much talk of recruiters being replaced, but I think this, marketplace-led app, for that not necessarily gig economy, but that environment where they've got people on demand, shift needed to fill quickly is just fantastic. It's needed. And I'm keen to understand what's next. I know you might necessarily want to tell your competitors what's next, but in terms of on the roadmap, which you can publicly talk about, what can people expect to see and hear from CareRev over the coming months?
Yeah. Well, we're investing a lot in, making everything smarter. So, AI to do better matching of shifts and pros, AI to manage the rates better. So our nurses can expect that to be easier. The second thing is it's a really complex ecosystem with lots of players. And we're investing a lot in interoperability so that we can integrate a lot more seamlessly with our hospitals and health systems, scheduling systems and time tracking systems, just to make it seamless on their end. And we're investing a lot in our integrations with the other parts of the ecosystem. And without getting into too much detail, like lots of hospitals use what's called an MSP, a managed service provider, to manage all their contingent spend. And they have these technologies called VMSs, or vendor management systems. And those are the portals through which hospitals enter all of their demand for any contingent staff, be it per diem nurses, on-demand nurses, travel nurses, radiology technicians, whatever it might be. So we're investing a lot in integrating with all of the major players on the VMS side to make sure that our clinicians can access that demand, that those shifts that are working through the MSPs, and to make it incredibly easy for the end client, so they don't have technology fatigue, having to deal with so many different technology layers. They just deal with the VMS, and then our technology does the fulfillment for on demand. So those are like our biggest investment areas.
Yeah, it's really interesting. I think you touched on something really valid there. I think there's, from my understanding of the US health market, and you've got older, more legacy, maybe more technology averse health systems providers, you're the ones who are really advanced. How are you kind of driving that message around AI? Because I know a lot of people, there is some reluctance and nervousness because maybe it's lack of knowledge more than anything. But how are you educating those chief nursing, chief HR officers over the benefit that AI as a core component of this product can actually bring them?
Yeah, no, it's a good question. I think in the hospital space, everybody's, it's the thing right now that everybody wants to understand better and everybody wants to leverage better. And I think the entire industry is still very much in an education phase of teaching them, how it works, what the value is, how to adopt it. Hospitals are, for good reason, they tend to be risk averse and change averse.
Rightly so.
Rightly so. And so it's really important. So two things are actually incredibly important. One is you can't just say trust the machines.
No.
Like you have to actually go through the education process of building comfort in how is it making decisions, why is it making decisions, and how that helps them. So you need to have that level of transparency and education. The second thing that's really important is it has to be, at least initially, hand-guided, meaning hospitals want to be able to say yes or no.
Yeah.
So, for example, and to have sort of controls over them. So, for example, on the smart rates technology. So, first of all, they have to have the ability to say, I want that or I don't. But second of all, they have to be able to trade guide rails around and saying, well, look, don't let the AI make these, the rate any higher than this or any lower than this to create sort of guardrails through it that you can work. And so it has to be sort of collaborative in that way.
Yeah, that's really interesting. Well, I think it's a fantastic product. I think, anyone listening to this, you should check you guys out. I think is what you're doing, the problem it's solving. It's no surprise you had the success and growth you've experienced. And Brandon, thanks for coming on. It's been, super interesting. I just think it's such a genuinely well-needed product, and solving that to nail the B2B and B2C side of any solution is kind of hugely admirable. So, especially in this space such as kind of clinician shortage and healthcare. So, congrats and thanks so much for coming on. It's been a lot of fun.
Awesome, thanks, Alex. I enjoyed the time.
Thanks, Brandon.
All right, take care.
Cheers.